Face, chin, and neck contouring can be invasive or non-invasive. This helps tighten skin and also remodel fat in the area. Common areas would include the lower face, double chin, and laxity of the neck. We can tighten skin within a non-invasive manner, but we can also do body contouring, face, neck, submentum contouring, non-invasively, but also in an invasive fashion. So this is where the complimentary consultation comes in. We evaluate the patient, determine their needs, talk to them about all the different procedures that we offer. Then we would determine which of our services best meet their need. We see patients as young as in their 20s, and we see patients into their 70s and 80s. More commonly, we are starting to see more men, where probably 5 years ago we weren't seeing as many men for these type of procedures, but it's come a little more prevalent in the media, and patients are more apt to ask about these type of procedures. When our patients come in and fill out an intake form, we do have a face as well as a body, and they can circle the areas of their concern. So it may not be their primary concern, but it's something we can definitely address, whether it be at their first visit or something in the future. It is all very similar. So depending on if it's non-invasive, there may be creams that we recommend using, sunscreen. If it's a more invasive procedure, we're often recommending it. They may even need to have some downtime. There's often a dressing that's applied to the area. So let's say we did a lower face and submentum, they might be wearing a dressing for 2 to 6 weeks. Same if we do a more invasive abdominal procedure, there's likely a wrap and a dressing that would be placed on the area for up to 6 weeks. So if body contouring is done by someone who's inexperienced, it could be catastrophic. They could go into an area that's not safe for the instrument. Also, the patient could have fat removed maybe in an area that they don't want it removed. Let's say maybe their upper cheeks, they want that to remain full, and they remove fat in that area. Also, depending on the type of body contouring, there's a very well-known procedure that can cause what we call a shark bite, or it almost looks like a little indentation. So we see, unfortunately, sometimes we'll see patients who have gone elsewhere where they didn't have an appropriate consult, and maybe the wrong treatment was performed for them for their needs. Every patient will be seen by one of our licensed skincare experts. If someone is receiving a body contouring treatment or facial contouring treatment, they will also be seen by either our nurse or myself as the physician. If the consultation's done appropriately, we should be selecting the appropriate treatment for their needs, really reducing the risk of adverse events.